Hello, good morning. This is Vincent Obita, and today we are going to cover evaluation of a news patient. And in the new test of competency Osce, this is an oral submission which you direct to the assessor, and it comes as a fourth stage of API, where you are going to give a handover to the next caregiver. It can be an end of shift report or maybe a transfer of patient from one unit to the next, and you need to give your report in a systematic manner using the SBAR technique, and this entailed situation, background information, assessment, and your recommendation of care to the next person. So this information you will be directing to the assessor and may take this form. For example, in this case, I'm going to give a handover of a news patient, and we will cover patient with asthma in this case, in this scenario. So your handover will take this form. Under situation, you will introduce yourself and give more identification information. So under situation, it may take this format. My name is Vincent Obita, one of the staff nurses in the acute medical unit. I'm going to give you an end of shift report for Joseph Smith, date of birth 20th of December 1972, who is currently in Bay 1, Bed 1. Then under background information, you will cover past medical history and may take this format as well. So Joseph Smith was admitted today morning, that is 20th of December 2022, with shortness of breath and cough, which has lasted for the last 3 days. He is diabetic, who is usually on metformin with the bloods well controlled. Is usually mobile and independent and lives with the wife. Is currently being managed for bronchitis and is on daily bloods. That one covers brief of the background information. Under assessment, you cover what you have done and what the needs of this patient, and this may take also this form. In terms of observation, Joseph Smith has a respiratory rate of 23. The oxygen saturation level is 96% and is currently on oxygen 2 liters via nosoprong. The blood pressure is 138/71. The pulse rate is 86. And the temperature is 37.2. The blood sugars as per now are 7.2 as well, and Joseph is able to move with the assistance of one due to the shortness of breath and also the need to have the oxygen being carried around. Is currently on IV antibiotics, which are on need to continue for 7 days. And the major concern for Joseph right now is the increased respiratory rate, which we have to keep an eye on to ensure that is currently doing well. That covers the assessment bit. Under recommendation, you will provide what the next caregiver need to do. Under recommendation, since Joseph is having respiratory issues, is diabetic, and is currently having increased respiratory rate, your recommendation to the next person ought to cover all these elements, and it may also take this form. I recommend Joseph to be referred to the respiratory team to discuss the issues with his breathing and the next course of action. I would also recommend Joseph to have his observations to be monitored 4 hourly, and any changes to be escalated to the doctor and to the nurse in charge as required. The diabetic nurse should also review Joseph to ensure that he is compliant with the medication and ensure that the blood sugars are maintained at a good level prior to discharge and also in the process of planning their exit to hospital. The fourth recommendation would revolve around involving the family members to ensure Joseph is comfortable throughout his stay in the hospital and also in preparation and in plans of his discharge. Those 4 elements will cover the evaluation for this patient, and as you can see, in under 6 minutes we've already covered all the 4 aspects. The only thing you need to do is use the paper that you are given at the evaluation stage. Jot some few stuffs to cover throughout and use them as your guide as you present your case to the assessor, and just fall within the limit and cover all the details, a better part of the details that you need to pass to the next caregiver. All this information, you will get them from the scenario case that you will be presented with during your assessment, and some of the information that we've covered in here you can also get them from your care plan and your implementation. When you talk of IV antibiotics and the metformin, all those will be in the medication chart, and that's where you capture all those information. Thank you very much. We'll be covering more information on evaluation and the new skills that have been introduced in Osce new test of competency. Continue subscribing and continue liking and make comment or any question that you would like to be covered in the subsequent videos. I'll be responding to them. Thank you very much and see you next time. Bye.